and also like having a better diet. I totally overhauled my diet just to, you know, cut out sugars and things like that. So, you know, just things to keep my overall body and mind healthy.
I would say for me, some tools that I used, two words, crocheting and TikTok. I used TikTok because I didn't know anything about cancer. I had no idea what was going to happen. I had no idea about chemo, so everything's on TikTok. So I looked on TikTok, and I saw a whole bunch of survivors and people just talking to themselves. So I started talking to them, and I just met a whole bunch of people, and that really helped me through my journey.
I think for me, it was sharing my story. So putting it out there, what I went through, so that in case somebody else was in my shoes at some point, that we could connect and help each other through the journey. And I also think data and research. I wanted to be treated as an individual for my individual case and what was possible treatment plan-wise for me. And so working with my team to find the best treatment plan.
Yeah, what a great diversity of techniques. And I feel like they all have a common thread of finding your own sense of groundedness, which is very important, as someone mentioned, the roller coaster of survivorship. I'm going to piggyback to the next question, which kind of, some of you alluded to this, of what are some programs or resources that were in your community that you found to be beneficial that you could tap into?
I would say John Stoddard's program was really, I had no idea. I knew John Stoddard existed, but I didn't know what they did. I knew they dealt with cancer, but I met the most wonderful people through John Stoddard. One sitting back there. I don't want to put her on the spot, but also their therapy and their young adult advocacy program. They walked me through everything, everything I was scared about, everything I didn't know about. They just shined a light on everything and just called me like once a week. I had therapy once a week, and it was just really great. So, John Stoddard.
Thank you, Britt. And it sounds like you were describing perhaps a nurse navigating program as well. Yeah, that's beautiful. Thank you.
I think for me, it was, I go to the Holden Comprehensive Cancer Center, and it was taking the mental well-being with my cancer treatment and also fertility. So putting those three pieces together and really working with the well-being of the overall person, not just solely the cancer diagnosis or treatment plan.
So Ryan also goes to the Holden Comprehensive Cancer Center. I think we were a little different. He was 36 when he was diagnosed, and it was in 2021, so we were still kind of reeling from COVID, and I think a lot of changes were happening along the GI route at that point in time. It took a little bit to get connected to the AYA Association, which has since been a huge help and a huge connection, but we went directly to organizations for pancreatic cancer specifically, and one of the huge ones is that's actually still helping us, and we're now on a patient advisory board, is Let's Win PC. They put out immense data on treatments, research, patient stories. We actually just did a video for them. So Let's Win is a phenomenal resource if you have patients that are diagnosed with pancreatic cancer. They've got a doctor finder on there now too, which is phenomenal. Anyway, I think going back to one of the things that was quoted earlier is not to reinvent the wheel. And especially when we're in the state of Iowa, you know, there probably aren't as many numbers in terms of pancreatic cancer diagnoses, although obviously the numbers are rising. I think utilizing whatever resources you possibly can, that would be a fantastic one to point people to.
Well, of course, I'm going to mention Survivorship 101, and that's a program thanks to the Iowa Cancer Consortium. We've been proud to be able to train a lot of facilitators in the state of Iowa to deliver this wonderful program, evidence-based program, to folks in their community, and we have a lot of interest in continuing that. And what is that about? That's just how to create your best life after cancer. How do I do that? And it's education, it's resources, it's mental health support, it's all of those things. And Iowa, I have to say, you all impressed me so much. You're leading the way when it comes to survivorship care, in my opinion.
Thank you, everybody. I also want to piggyback. First of all, Brenda, I participated in a Time to Heal program on brain fog, and I think that's an important service that's available to anybody, because it is a virtual program as well. And I'm also, again, hearing these general themes of things that you guys found beneficial: community, empowerment, education, strategies to manage your treatment. And I'm going to give a selfish shout out to Above and Beyond Cancer. I maintained employment during my cancer survivorship, and so as I was teaching programming, I also became a self-benefactor of what I was wanting to still in other survivors. And as we did our mindfulness break earlier, for me to manage a peace of mind, mindfulness-based practices that Above and Beyond Cancer offered grounded me so much. And of course, I was able to utilize the services at the Richard Deming Cancer Center that Ryan talked about, integrative services like acupuncture, counseling, massage therapy, healing touch therapies. I agree, Brenda. Iowa is the Des Moines metro area, and what we're offering in our variety of clinics and with Above and Beyond Cancer is really outstanding of what we're offering cancer survivors as tools. So I'm happy to hear that you have all had different things in your community to support you. So now we're going to go to the flip side of that question in regards to what do you think things survivors are dealing with that the community has yet to speak to, or you did not have available in your particular community, whether you didn't know about it or it doesn't exist? What are some supports you wish you would have had that you didn't?
Well, I know a lot of survivors and people going through treatment are dealing with work when they shouldn't have to work, when dealing with cancer or any other illness that is debilitating. Right now, we only have 12 weeks with the Family Medical Leave Act, FMLA, and I am learning how to get that increased. I had no idea that a lot of people were working and getting chemo at the same time. And I don't want to get too emotional because I am really passionate about it, because when I went to those treatment centers, people had their laptops up working, and people were very concerned about how they were going to feed their kids. We had single moms working, going home, making dinner, giving baths, taking care of. I saw a woman with 6 children she had to take care of by herself and had to be a nurse. So she wasn't just taking care of her family, she was taking care of other people who were sick, and that shouldn't be the case. So that's something I feel like needs to change. We need a program, We need a program or something to fix it, or more hours or weeks with FMLA.
I wholeheartedly agree. From both the patient standpoint and the primary caregiver standpoint, it wasn't until we were heading to New York City last summer for a clinical trial where Ryan couldn't do the clinical trial without having a caregiver there. So I had to go with him. And I had a hard time with work. And because we had to move to New York City for 3 months. And it wasn't even, it was, depending on how he did, it could have been 3 to 6 months. And so it's like, okay, well, you've got the 12 weeks of FMLA, but you can't take your own vacation. You can't use sick leave. You can only do vacation if you do caregiving FMLA, just FYI, which I'm sorry, I'm going to get on the bandwagon. I think that is absolutely asinine. And the other piece is that I am doing everything else. So we quickly kind of coined this term, the body and the brain. So, Ryan is the body, everything is happening to him. I am the brain, I take care of everything else. I take care of our kids, our finances, our house, all of the things, so he can solely focus on being treated. And to sometimes physically leave the house and go to work some days was so hard. Just stressful, you know what I mean? Like I just couldn't get myself to a point where I was trying to get my kids together and get him together, because there were times where he wasn't quite right either. And again, 12 weeks is ridiculous. And for a caregiver then to have to use vacation and they couldn't use sick leave because that's the law, the way that it is also absolutely ridiculous. Cancer is not just a 12-week thing, and we need more.
You're not a caregiver, you're a co-survivor. Yeah. That's how you should be treated.
Thank you. You know, what I'm hearing again is this financial toxicity theme that is very complex, that continues to need to be addressed, and also needs of caregivers, unique needs of caregivers and support. Are there things you wished you known more about at the beginning of your journey? Looking back, is there wisdom you wish you would have had earlier?
Some of the challenges that could have been maybe better addressed, in my opinion, is timing-wise with healthcare providers. And you guys, I'm not pointing fingers. I love you all, and sometimes it's administrative, right? But referrals for aftercare, referrals for support, it is not enough, and it's not appropriate to dump a whole bunch of literature in a bag and hand it off. It needs to have more meaningful, more purposeful timing. It needs to be I think sometimes at the end of treatment. Well, let me put it this way. Don't do it when they're having an infusion, please, for one thing. I was approached at that time. Maybe it just needs to be a completely separate appointment to talk to folks about what's going on, money-wise with you. Here's help over here. What's going on? Do you need housekeeping services? Do you need food? Do you need, are you suffering with any kind of side effects that are just debilitating for you? I just think there needs to be more purpose and meaning behind the timing of those resources being presented to the patient.
I think also to go along with that is just some help navigating the whole journey or the whole process. As patients and caregivers, we're it's such bad news or difficult news to take, and then try to ask the right questions and things like that. So Brooke and I have worked with some pancreatic cancer organizations specifically on what are the questions that should be asked, at your first appointment. So you just got diagnosed, what should you be asking? What's important to know? Follow-up things, asking about clinical trials, just all kinds of different variety of topics, because in the moment, it's not there. And it's like, you go home and it's like, oh, maybe I should have asked about that, or maybe I should have, done this. So maybe some hospitals have like a navigator, somebody, or an advocate almost, but I mean, I'm kind of lucky in the fact that first of all, I have her, but also that young enough to maybe think of some of those questions in a weird way, whereas I sometimes wonder how older people who have cancer, how they navigate just that journey and the things as simple as getting meds and issues with that I've had that have just been taken for granted, that we should know this, or that patients should know this, and yeah.
I'll echo that. I think about that a lot, actually, about, if you don't know what you don't know, and you have to become your own biggest advocate. I think something that I realize now that I wish I knew back then was just that I had to be my own biggest advocate. I think sometimes we're just told what the treatment plan is or what the most common treatment plan is, and options are not explored. And so I wish I would have known that. I actually got a second opinion is how I ended up in Iowa City, but I did not know my options or how to treat ovarian cancer as a 27-year-old in my first diagnosis. And I think that makes a very large difference because fertility was at the top of my list of how are you going to address my hopes to be a parent someday, and that can look a lot of ways, right? So I think just more education that one size fits all is not the answer. You have to treat it on an individual case.
Yeah, so again, I'm hearing a lot about education, empowerment. What's the timing of that? How do we find the resources? Are there ways to know in advance? These are questions to consider for your healthcare team when you're ready to ask them. Thank you. That's a pretty complex thing. As you said, each individual's different. It kind of puts a lot of pressure on our medical professionals to read the body language, right, of when somebody might be ready to hear information or not ready to hear information. What's the right timing of that? Because I've heard it all across the board as well. Like, I got so much information, it's really overwhelming because they wanted to make sure, all the healthcare providers are giving them really great information. And then sometimes, I wish I would have known about that before. And again, maybe it was shared and we're so traumatized by everything else, it's hard to absorb all of it. So I do think that education empowerment component it's complex. And so maybe there, again, needs to be a variety of ways to receive the information for when we're ready to digest it.
Remember the old marketing rule, how many times? 7, at least an average of 7 times, right? Yes, until the message sinks in. And I also think it's okay to repeat. A lot of us have brain fog. Please repeat.
So I have 2 more questions left here, and then we're going to open it up to all of our wonderful people here at the summit. This next question is shifting gears to the people in a community. What were some of the most helpful things that you received from your community of people or your caregivers or advice that really made a difference for you?
I think something I wrote down earlier I was thinking about is my advice actually to caregivers is offer your unique strength. Okay? What do you do? What could you do for this person that maybe no one else could or maybe no one else would? Whether it's maybe you have a lot of dogs and you love to walk dogs, maybe you're going to walk through the dog for them. Maybe it's knitting and you want to knit them a shawl so we can be warm up here today, or a cap or something like that. Maybe you're really good at cooking and you could actually cook them something that they might really like. What is it that you do? And what I would say on the other side of that coin to us survivors, let them do it. Even if you don't want it, as long as it's not going to be invasive to you, let them do it. Because people feel so helpless around us, right? They want to do something. Just let them.
Piggybacking off that a little bit, which is so spot on. Again, people don't know what to do. Those who do want to help come and say, well, let me know if you need anything. I'm busy trying to keep someone alive here. It's not until the moment where I'm like, oh, that would have been a good thing to tell them to do. So if you have something that you're good at or that you like to, just do it. Just say, hey, I'm bringing you dinner at 5 o'clock today. You don't need to ask. You don't need to, if you want to get the meal train together and you coordinate it, if you're great at coordinating people, do that. Just don't ask because we don't know what we need, and when it comes time to do that, it's too late to ask. And, you know, a lot of times you don't want to be a burden on somebody else. One of the things, so from a caregiver perspective, you know, and really survivors too, get your sleep. It really does help. So if you need to talk to your PCP or your oncologist to get a sleep aid because you're not sleeping, do it. Get something that helps you to sleep. At least then you'll be refreshed for the next day and ready to fight, and everybody feels a lot better when they're able to sleep. And then again, from a caregiver perspective, if you're taking care of your loved one, don't worry about asking a million questions, and ask the question until you get the answer that you're looking for or that makes sense. So a lot of times, as great as their care providers are, they'll respond and it may not make sense to you, but instead of you wanting to rock the boat, you just say, "Oh, thank you." Keep asking the question until it makes sense and keep pushing for answers. If you're not getting an answer that you think is acceptable, keep pushing, keep asking.
Just to piggyback on, you know, if you don't know what to do for somebody and you want to do something, just tell them, text somebody and say, "I'm dropping it at your door." That way they don't have to entertain you. Do you know what I mean? Because a lot of times that we can't even do that. We can't even sit on the couch and talk to you. So, but we are so grateful that you dropped something at our doorstep.
I definitely want to piggyback off that. I did not want help, but I didn't even know I had such a big community. I knew I had a big family. They were all there, and I loved them for it. But I had no idea that I had a community at work, and I received like so many notes and cards and letters, and I didn't know how much that would mean to me, or even them dropping off like pasta and, like you said, leaving it at the door, because I was so sick, and I'm a talker, and I love people. I didn't want to talk to anyone, and I didn't want to talk to anyone from work, and they just left it on the stoop. So I just had to learn how to let people help and let people do, and they did, and they were. I don't know how I wouldn't have been able to get through that positively as much as I did without those people. So community was really important.
I think mine would be just having someone to listen. So whether that's friends or family, I think a lot of times you have a lot of opinions coming at you, right? From either medical team support, your community, but just having someone to like listen, because even I'm 8 years post-diagnosis, the grief is a lot sometimes and just the life I imagined for myself. And so having those people just listen and not always having to give input or respond, but just knowing like we can just sit on the couch and have a conversation, those are some of the best moments.
Thank you. That is really beautiful testimony on the power of community. And I do want to, go ahead.
Sorry. I was also just going to say that a lot of times at the beginning when you first get diagnosed, everybody kind of comes out at the, what can I do to help, things like that right away. And then, it's the cancer battle is never over. And in my experience, it's come again over and over again just in 4.5 years. And so there's that support there maybe right at the beginning, but then as we go along, it's like, thinking things are better, or even when things are looking better, it's not necessarily, there is still a level of support that might be needed, and help that can still be given, that it's there in droves right at the beginning, but may not be there, further along in the fight.
So true. So the power of community, the power of saying yes to your community. What's really also valuable is studies have shown that a survivor's sense of resilience improves their outcome. And also their sense of resilience is based on their community. So the stronger the community, the more they feel resilient in their journey. So our community is very important. And as a survivor, the other thing I would say is also we don't always want to feel like a cancer survivor. We also want to be around our friends and family and not talking about our cancer all the time. We want to be treated still as a friend, still come to for advice, still come to for the bitching and the moaning about whatever's going on in life. Like, we want to have the opportunity to have a purpose to give friendship back to other people, to your friends and family. I pardon my words, I'm sorry. Or not sorry. Cancer card, I can say whatever I want. Okay, last question before we open it up to the audience. One piece of wisdom or advice that you would share with another cancer survivor?
I guess my main thing is that you are not alone. That is something that you kind of feel when you're not in it and you first get diagnosed. It's like I am alone in this. Besides immediate family and friends, but we have learned to join a community and for pancreatic cancer. And help others. We've helped, or Brooke does a lot of it, but working with people from, I don't know, Japan or something you've even connected with through social media. And we've, next month is Pancreatic Cancer Awareness Month. We're doing some things with some other survivors, and I think that for me has been very helpful in feeling that other people are going through this. Yes, your experiences may not be the exact same, but at least you know that other people have this, even though it's obvious that there are people out there. But you can find people that are having similar side effects, and what do you do? And so there's been lots of brainstorming on different topics and things that I would never have without making these connections and having this now community, cancer community, with me, all along this way.
I think mine for another cancer survivor is always get a second opinion. My first diagnosis, my option was a hysterectomy with no fertility preservation. My second opinion was not to do a hysterectomy, and I could do fertility preservation. And so that just speaks to the research team and what other options are out there depending on where you're at. I think the one piece of advice I have to anyone that works with a cancer survivor is your words matter. For a cancer patient or survivor, you're hearing a lot of this for the first time. And so, like was mentioned earlier, bad news is delivered every day in this community about a cancer diagnosis, but how you deliver those words or the follow-up appointments and the whole journey, the words matter, the approach matters, and you have the opportunity to make a positive impact on someone's life.
Definitely say research. Definitely research and second opinion, of course, and definitely community. I had someone close to me get diagnosed with cancer recently, and that was the question to me is like, what do I do now after my diagnosis? And that was my thing, is research. Learn all you can about your diagnosis. Take notes or have someone take notes for you at your appointment. I had my mom on FaceTime and she was recording, or my boyfriend recorded or took notes. But yeah, as much research as you can and as much community as you can. So
I have a couple things. As a survivor, find the silver lining. Whatever that is that day, find it. It's there. You're going to have to hunt really hard for it some days, but it is there. So you heard me talk about I got really sick with adriamycin and I lost 30 pounds, but hey, I lost 30 pounds. Silver lining. Then my next round of chemo, I think it was Taxotere, some awful thing like that, and you get neuropathy and you get joint pain, but I could eat and I could drink. That was my silver lining. I just had foot surgery. I'm 8 years out. I still have neuropathy in this right foot. I don't feel a thing. I didn't have any pain pills. Neuropathy for the win. It just, sometimes that's what you need. to get you through the day, and you know, that's okay, I think. Is to just find those silver linings and tap into that resiliency and just keep moving.
Perspective matters, doesn't it? Yes. Yeah. I would add on, focus on what's in your control. As our survivors said before, that survivorship is stressful, it's demanding, it's a roller coaster, it's unexpected. Often our lives seemed inside out. And if you can focus on, maybe right now I can breathe, maybe right now I can stretch, maybe now I can go for a walk, maybe I can call a friend. What are the small things that you can do for yourself? That is my advice. Questions from our audience?
Hi, Dick Deming, Mercy Cancer Center. Thanks for your perspective, your insight. Clearly, the cancer journey is difficult, and my next question is not to make light of that, but cancer can be a teacher. And my question is, how are you different now than you were before? What did cancer teach you, and how are you changed because of your cancer journey, besides a numb toe?
Dr. Deming, I can always trust you to get right to it. Remember I talked about destiny? That was my word. So I've been working in nonprofit for a number of years, very happily, over 30 years. A lot of those years I have spent in healthcare fundraising. And I found I really had a passion for that, loved it. As time went on, as one does, I decided I needed to travel less and took a job for a children's organization, wonderful. Didn't truly have my heart, but it was great. And then a friend came to me one day, and she said, I got to tell you about this great organization I'm working with. They're looking for a new executive director. Maybe you can help me find that perfect person. And it was the Time to Heal Cancer Foundation. And I said, this is why I got cancer. Sorry, but not sorry. I'm so proud. I could not lead and be as effective as I've been without having gone through this. So.
No apologies for your destiny.
For me, it's, Ryan and I were both 36 when he was diagnosed, or technically I was 35. But, you really learn to slow down and enjoy all of the moments. When he was first diagnosed, we didn't know how long we would have. Our kids were 3 and 5, and they're now 8 and 10. It is possible to make it 4.5 years post-pancreatic cancer diagnosis. At some point in time, this was, I think, a couple years ago or something, and we had gone to bed. He, of course, had fallen asleep because he's so tired, and he was snoring so bad. And I'm like, oh my God, great. And then for a second I thought, you know what? Thank you, God. Thank you that he's still here. Thank you that he's snoring and keeping me awake, because as annoying as it is, he's alive. And that's all that matters. So the small moments, We're grateful for every day that we get.
Yeah, to piggyback off that too, I guess just every day is a blessing, not taking things for granted, and, just live life to the fullest. We've gone on trips and things that, we questioned or had never done before, but it was like, we're saving it for what? What are we saving it for? Because it might not be here. So, just live life to the fullest and appreciate every day.
I would say, for me, kind of piggybacking off of them, I was a workaholic. I worked from 5:30 to probably like 7 p.m. I loved it. It was like a hum. And when I got diagnosed, I didn't have that anymore. And it took me back to when I was 19 and I was running a girls program and I was free and I could do whatever I want with those girls and just take them on adventures. And it just brought me back to what my one true love was, and that was working with people, working with girls and young adults. So it gave me back, I would say, my identity of who I really was and not this corporate robot that I became. So yeah.
For me, my least favorite class in high school was public speaking. And so now I love going places and sharing my story and sharing the power that a provider has to make, like I said earlier, a positive influence on someone's life and to help them see their future. And also just a great community of survivors that I've met. I have several friends that I probably wouldn't have crossed paths with at different places, various places across the country, if we hadn't had this thing in common.
Beautiful. Thank you, Dr. Deming, for that great question. I would say my lessons have deepened compassion and gratitude and cleared my path for priorities in my life. I want to end with a quote from my middle school icon, Olivia Newton-John, who passed away from cancer a few years ago. And Olivia Newton-John said, "Cancer is a journey, and I am determined to make it a beautiful one." Let's give a round of applause to our cancer survivors.